This is Chris from OrthoWell PT again. Let's talk about unloading or self-traction. Self-traction is a great way of decompressing your spine, taking pressure of maybe a disc that might be compressed, a nerve that might be pinched in your low back. By doing traction intermittently, 10 seconds on, 5 seconds off, you create like a mechanical pumping effect in that disc area or in the spine. So it can be great for pain, great for swelling, and great for speeding up the process of recovery. In the clinic here, we have a nice setup here. It's a high-low stand. You can, maybe in the gym, you can put the full stack of weights on a pull-down bar and hang from the bar, or if there's a chin-up bar, possibly in the gym. I'll show you here in a second this unit called the door gym, okay, just as another option for home. But the technique, essentially, is, so hands up, I'm going to step forward, keeping my feet flat, and I'm going to drop straight down from my hands. So my hands, my head, shoulders, hips are in a straight line. Okay? I'm not intentionally trying to stick my butt out. I'm just trying to unload my spine. I'm not trying to dangle by lifting my feet up, keeping my feet flat. I'm essentially just trying to unload my spine by taking about 50% of my body weight through my hands and off of my legs. Okay, I hold here for 10 seconds. Relax. Make sure you don't hold your breath or tense any muscles. And then after 10 seconds, you step back and rest. Okay, your arms a little break. Grab the bars again, step forward, drop straight down, 10-second hold, okay, and then step back and release. Okay, on the brochure we talk about maybe 10 times, it can be 10 to 20 times, it can be as often as you want to during the day. If it helps, if it makes it feel better, then do it more often. Okay, Matt, let's go this way. Let me show you a couple more options over here. So on a door, you can take any door in your house, a towel roll. Okay, these are pretty industrial strength doors here at the Cummings Center. But at home you can take a towel roll or a little booklet or a magazine and stick it here so it reinforces the door, taking place a towel on the top and kind of straddle the door, and essentially the same sort of thing. 10-second holds. 5-second rest. Of course, you want to make sure you have good shoulder motion and strength to be able to do this. Okay, so the door gym I mentioned is over here. This is not the ideal setup here. This is more of an industrial door. So typically at home, you'd put this on the door jamb, on the door sill on the opposite side, and these two would rest on the wall on a regular sized door at home. Of course, this is a commercial door, so it's going to be wider, but just for demonstration purposes, hopefully this won't come off as I do it. But same idea, stretch, not stretch, you're decompressing. You're not really stretching muscles as you provide traction. You're just unloading the spine. 10-second hold, 5-second rest. Okay, so door gym, we got that listed on the brochure. Okay, a couple other options, I think the iron gym or something they call it too online, but and this is actually I think the gold gym, door gym. So. Alright, there's one last option. You can get on the floor and do traction in a doorway. Okay, so when you go get down, be careful. Let's have you go down to one knee, then down to two knees. And let's have you typically kind of go forward and then roll onto your back, respecting your body mechanics, not to pinch anything. So, and then you lay. Same idea, dowel here. A broomstick, a baseball bat, whatever. I've got it about belt level, okay, relaxed, my feet are flat, and all I'm doing is I'm pushing. So I'm pushing against the stick, so you can see my body move, so I'm providing a little bit of a tractioning effect to my lumbar spine. So hold about 10 seconds, same idea as before, 5-second release. Some people actually put like a little towel or something here, just to raise their back off the floor so they don't have that frictioning effect. But sometimes that little bit of friction of you pushing kind of creates that little bit of that sense of more of a traction effect at your low back. So 10-second hold, 5-second rest. Okay, and that's good. Thanks a lot.